Ever wondered what an aneurysm is and how it can impact your health? Let's break it down for you. An aneurysm is a swelling or bulge in the wall of a blood vessel. It's like a tiny time bomb nestled in your body, often silent and undetectable until it's about to burst. They can occur in any blood vessel, but are most commonly found in the brain, known as cerebral aneurysms, and in the aorta, the body's main artery, hence called aortic aneurysms. The various types of aneurysms, such as fusiform and saccular, are classified based on their shape. Fusiform aneurysms, for instance, bulge all around the circumference of the vessel, while saccular aneurysms bulge on one side. It's crucial to understand that aneurysms can lead to life-threatening conditions if they rupture. Now that we know what an aneurysm is, let's delve deeper into its causes. Aneurysms don't just appear out of nowhere. Certain factors can certainly contribute to their development. So, let's delve deeper into the causes of aneurysms. First up is high blood pressure, often regarded as the most common cause of aneurysms. Our blood vessels are designed to withstand the pressure exerted by the blood flowing within them. However, when this pressure intensifies, it can weaken the walls of these vessels, creating a ripe environment for aneurysms to develop. Next, we have high cholesterol. This silent enemy can sneakily cause the buildup of plaque in the arteries, a condition known as atherosclerosis. Over time, this plaque can cause the arterial walls to thicken and harden, reducing their flexibility. This loss of elasticity, coupled with the pressure of the blood flow, can result in an aneurysm. Now, let's talk about genetics. Yes, you heard it right. Aneurysms can also be a family affair. Certain genetic conditions like Marfan syndrome and Ehlers-Danlos syndrome can make people more susceptible to aneurysms. These conditions can cause defects in the body's connective tissue, which is a critical component of our blood vessel walls. Such defects can weaken the walls, making them more prone to balloon out and form an aneurysm. Furthermore, lifestyle factors can also play a role in the development of aneurysms. These include habits like smoking, which can damage your blood vessels, and excessive alcohol consumption, which can elevate your blood pressure. Even factors like age and gender can influence the likelihood of aneurysm development, with men over the age of 60 being at a higher risk. In summary, aneurysms can be caused by a multitude of factors, ranging from high blood pressure and high cholesterol to certain genetic conditions and lifestyle choices. Understanding these causes is the first step towards prevention and early detection. We've just understood the causes, but what about the risks involved? Let's find out. The risks of aneurysms can sometimes be as silent as its causes. Let's delve deeper into the risk factors associated with aneurysms. First, age plays a significant role. As we age, our blood vessels naturally weaken, making them more susceptible to aneurysms. The risk is generally higher for individuals over the age of 60. Second, gender is another factor. While both men and women can develop aneurysms, research suggests that women, particularly those post-menopause, are at a higher risk. This increased risk could be due to the decrease in estrogen levels, a hormone that helps keep blood vessels flexible. Now let's talk about lifestyle choices. Smoking is a major risk factor for aneurysms. The chemicals in tobacco smoke can damage and weaken your blood vessel walls, making them more prone to aneurysms. The more you smoke, the higher your risk becomes. Similarly, excessive alcohol consumption can also increase your risk. Alcohol can raise your blood pressure, and high blood pressure is a leading cause of aneurysms. It's like increasing the pressure in a balloon, making it more likely to burst. Next, we have family history. If your parents or siblings have had an aneurysm, your risk may be higher. It's crucial to know your family's medical history and share it with your doctor. Certain medical conditions can also increase your risk. For instance, people with high blood pressure, atherosclerosis, or certain genetic conditions like Marfan syndrome and Ehlers-Danlos syndrome are more likely to develop aneurysms. Lastly, ethnicity can play a role. Studies show that people of African descent are more prone to certain types of aneurysms, particularly those affecting the brain. Remember, the presence of these risk factors doesn't guarantee you'll develop an aneurysm, but they do increase the likelihood. It's essential to be aware of these risk factors, especially those within your control, like smoking and alcohol consumption. We've understood the risks, but can aneurysms be prevented? Let's explore this next. Prevention is always better than cure, and it's no different with aneurysms. What's the first step to prevention? Maintaining a healthy lifestyle. This is a broad concept, but it includes various factors like maintaining a balanced diet, managing stress, and getting enough sleep. A balanced diet means incorporating fruits, vegetables, lean proteins, and whole grains into your meals, while minimizing your intake of high cholesterol and high sodium foods. You see, when you consume excess cholesterol and sodium, they can accumulate in your blood vessels, potentially leading to aneurysms. Stress management is equally important. Chronic stress can increase your blood pressure, which can strain your blood vessels and possibly contribute to aneurysm formation. So, take time to relax and unwind. Whether it's through meditation, yoga, or a simple walk in the park, find what works best for you. Getting enough sleep is also crucial. Lack of sleep can lead to various health issues, including high blood pressure, which, as we know, is a risk factor for aneurysms. Aim for 7 to 9 hours of sleep per night to keep your body functioning optimally. Next, let's talk about exercise. Regular physical activity keeps your heart and blood vessels healthy. It promotes good blood circulation and helps maintain normal blood pressure levels, thus reducing the risk of aneurysms. Whether it's brisk walking, swimming, or weightlifting, find a form of exercise that you enjoy and aim to be active for at least 30 minutes a day, 5 days a week. Lastly, regular checkups are essential. Even if you're in good health, regular medical checkups can help detect any potential problems early on, including aneurysms. Your doctor can monitor your blood pressure and perform tests to assess your blood vessels' health. Remember, these preventive measures don't guarantee that you'll never develop an aneurysm, but they do significantly reduce your risk. It's all about maintaining healthy blood vessels and leading a lifestyle that supports your overall health. Now that we've covered prevention, let's take a look at how aneurysms are diagnosed. Diagnosing an aneurysm early can make a world of difference. When it comes to finding these hidden ticking time bombs, doctors have several tools at their disposal. The first step is usually a physical examination. This can involve a careful check of the body for signs of an aneurysm, such as a pulsating mass in the abdomen or unusual sound in the chest. However, because aneurysms often show no symptoms until they rupture, additional tests are typically needed. That's where imaging tests come in. These include computed tomography or CT scans, which can produce detailed images of blood vessels and surrounding tissues. Magnetic resonance imaging, or MRI, is another powerful tool for visualizing aneurysms, offering high-resolution images of both arteries and veins. Then there's an ultrasound, a non-invasive test that uses sound waves to create images of blood vessels. This is often used for diagnosing abdominal aortic aneurysms. Cerebral angiography is another method used, especially for brain aneurysms. This test involves injecting a dye into the blood vessels of the brain to make them visible under X-ray. Genetic testing is also becoming increasingly important in the diagnosis of aneurysms. Researchers are finding links between certain genetic conditions and a higher risk of developing aneurysms, so a genetic test can provide valuable information for both diagnosis and risk assessment. Early diagnosis is crucial, but what happens once an aneurysm is found? Stay tuned to find out. Once an aneurysm is detected, immediate action is necessary. The treatment of aneurysms is multifaceted, encompassing a spectrum of options from medication to surgical interventions. Let's delve into this further. The first line of defense is typically medication. This can be used to control blood pressure and reduce the risk of rupture, which is the primary danger of an aneurysm. Medication can also alleviate symptoms, providing some relief to those affected. But sometimes medication isn't enough. In these cases, doctors turn to surgical procedures. One common operation is aneurysm clipping, which involves placing a metal clip around the base of the aneurysm to stop blood flow and prevent rupture. Another surgical option is aneurysm coiling, where a catheter is used to place a coil into the aneurysm to promote blood clotting and prevent rupture. For those with an abdominal aortic aneurysm, endovascular surgery might be the chosen course. This procedure involves inserting a stent graft within the aneurysm to provide support and prevent rupture. These treatments, while invasive, can be life-saving. They aim to prevent the worst-case scenario, a ruptured aneurysm, which can lead to life-threatening internal bleeding. So while aneurysms are undoubtedly serious, they're not unbeatable. With the right knowledge and medical attention, they can be managed and, in some cases, prevented entirely. It's clear that aneurysms are a serious health issue, but with knowledge, we can manage and even prevent them.